Skincare is important for all of us, but there are certain skin concerns that seniors should be paying attention to, and for different reasons. Dr. Leslie R. Coker from Associates in Dermatology is here to walk us through some of the most common conditions seniors are concerned about. Dr. Coker, welcome back to the Hampton Road Show.
Thank you.
Okay, as I get older, I notice my skin is changing. There are certain things I'm unsure about. One of them are skin growths.
Right, you're collecting your ornaments.
Things are happening I don't know about.
Little decorations.
Little decorations, yes. My little friends, I call them.
The most common thing that patients present with, they're growing, new spots they're concerned about are seborrheic keratoses. So it's a common
SK, right?
SK. That's a common reason for a visit. A dark brown spot. Here's a picture of it. They can present as dark brown, waxy, smooth, or they can be crusty, grayish growths, and they're mostly a cosmetic concern, but sometimes they'll become irritated and become a problem, and that's when we freeze them off. Anybody who's been to a dermatologist knows this. Yeah, especially around the neck, they can become a real burden.
And what's the difference between an SK and an AK?
The AK, so they share the same last name, meaning a crusty growth, but you can see on this picture, fair skin folks, especially in areas of sun damage, you're going to get these crusty, sometimes tender growths. Now, these are more of a considered precancerous, and we'll often treat them in the same way with the liquid nitrogen, but there's other modalities to treat them as well. They are typically in sun exposed, whereas the SKs can be anywhere and everywhere. Okay.
Another big concern for seniors is bruising. And, you know, sometimes they fall and then they bruise, and it happens so quick and it stays there for a long time. Why is that?
Or they don't even, it might not even be a bruise or they've fallen. It might just be a touch of the purse, the wristwatch. As we age, our skin becomes more fragile, it becomes less hydrated, it tears easily. A simple shearing effect or a rub can cause bleeding under the skin, and it causes these unsightly yet benign, or they're more cosmetic, they're colorful. They can start out as this bright pinkish maroon and go to purple, and over time they tend to stain the skin. As you think of iron in our blood, rusty coloration, staining the skin, this sort of rusty color.
Now we have a little bit of time left, so let's cover some ground quickly. Varicose veins. Why is that happening?
Leg swelling. If you have venous insufficiency, you get swelling of the legs, become discolored, and that can be a problem because the skin is unhealthy and won't heal from simple tears and ulcers or a problem.
What about toenails, the yellow nails?
Most folks think that if you have a thickened yellowish toenail, it's always due to fungus. That's not always it's usually, oftentimes trauma and poor circulation, you'll start to have that thickened yellowish coloration. If
you have any questions about any of these conditions, Dr. Coker can answer them for you. She is Dr. Leslie Coker at Associates in Dermatology, located at 17 Manhattan Square in Hampton. Give her a call, 757-838-8030, or find them online, aiderm.com. Thank you very much.
Thank you.